Right. Let's talk about something most blokes won't bring up at the pub, shall I? I'm Dr. Amelia Wright, and over my 25 years in sexual health medicine, I've heard this question whispered in consultation rooms more times than I can count. Today, we're addressing it head-on. Is swallowing seminal fluid actually safe? Now, I know some of you might be thinking, bloody hell, bit forward in it. But stay with me. This isn't about shock value. It's about giving you proper medical information so you can make informed decisions about your intimate life, whether you're in your 50s, 60s, 70s, or beyond. Because let me tell you, questions about sexual health don't retire when you do, and neither should honest conversations about them. I've been practicing medicine since before mobile phones were commonplace, and one thing hasn't changed. People deserve straight answers without the embarrassment. So let's treat this like any other health topic, with respect and science, not shame. Before we can talk about safety, we need to understand what we're actually discussing. Seminal fluid isn't some mysterious substance. It's a complex biological fluid, and understanding its components is the first step to demystifying this whole topic. When we talk about seminal fluid, or semen, we're talking about the fluid expelled during orgasm. Its primary biological job is to transport sperm, protect them, and nourish them on their journey. But here's the thing, the sperm cells themselves make up less than 5% of the total volume. The other 95%, that's seminal plasma, produced by several different glands in the male reproductive system. Let's break down what's actually in there, shall we? First off, the vast majority, over 80%, is simply water. That's what gives it its liquid form. Nothing complicated about that. Next, we've got fructose. That's a type of sugar produced by the seminal vesicles. You might recognize fructose as the sugar found in fruit. Its role here is crucial. It's the primary energy source for sperm, essentially the fuel that powers their swimming. Without it, they wouldn't stand a chance of reaching their destination. Then we have proteins and enzymes. Semen contains rather sophisticated proteins that perform a clever little dance. One you might have heard of is PSA, or prostate-specific antigen. Right after ejaculation, certain enzymes cause the fluid to thicken, which presumably helps keep it in place within the vaginal canal. A few moments later, other enzymes liquefy it again, releasing the sperm to begin their journey. Quite an intelligent biological process, actually. Finally, there's a mixture of minerals, zinc, calcium, and potassium, amongst others. Zinc is particularly important for sperm health. The fluid is also slightly alkaline, which is actually a protective measure. The vagina is naturally acidic to ward off harmful bacteria, but that environment is rather harsh for sperm. The alkalinity of seminal fluid helps neutralize that acidity, giving sperm a far better chance of survival. So, when you put it all together, it's primarily water with a bit of sugar for energy, a mixture of clever proteins for protection, and a pinch of minerals. It's a highly specialized fluid designed for one purpose: reproduction. Not nutrition, not health enhancement. Reproduction. Now that we've established the basics, let's address the central question: safety. To answer this properly, we need to look at it from several angles: digestion, nutrition, allergies, and the most important factor of all, the risk of sexually transmitted infections, which we call STIs for short. That stands for sexually transmitted infections, by the way. You might have heard them called STDs in the past, but the medical community mostly uses STI now. Let's start with the simplest part: digestion. From a purely digestive standpoint, swallowing fluid from a partner you know to be healthy and free from infections is generally safe for a healthy person. When seminal fluid enters your stomach, it's treated like any other food substance. Your stomach acid is incredibly strong and breaks down the proteins and sugars just as it would with protein from a piece of chicken or a glass of milk. The amount is typically quite small, on average less than a teaspoon. It's not toxic, it's not poisonous, and your body can process it easily. So if we set aside all other risks and just look at the fluid itself, your digestive system handles it without any problem whatsoever. Now let's talk about nutrition, because this is where one of the biggest myths exists, and I want to clear this up straight away. You may have heard it's some sort of superfood, packed with protein. Let me be absolutely clear, that's complete nonsense. Whilst it does contain protein, the amount is minuscule, roughly 200 to 500 milligrams. For comparison, a single egg white contains about 3,600 milligrams. You'd need to swallow a huge, completely unrealistic amount to get any real nutritional benefit. The same goes for calories. An average ejaculation has only 5 to 15 calories. That's less than a single Tic Tac. The amounts of vitamins and minerals present are also just traces. The idea that it could be a health supplement is simply not supported by science. Its purpose is biological, not nutritional. And whilst we're busting myths, let me address something I've seen in the comments and heard in my practice: the testosterone myth. Some people believe that swallowing semen provides a testosterone boost. This is categorically false. There is virtually no testosterone in seminal fluid in any meaningful amount. Even if there were, testosterone taken orally is broken down by stomach acid and wouldn't enter your bloodstream in any usable form. That's why testosterone replacement therapy is given as injections, patches, or gels, not as pills you swallow. So if anyone's told you it'll boost testosterone levels, they're either misinformed or having you on. Right, this brings us to the part that concerns me most as your doctor. The primary medical risk of swallowing seminal fluid is the transmission of STIs. This is the main health concern with oral sex. Full stop. If you're having unprotected oral sex, you're exposing the soft, permeable tissues of your mouth and throat to your partner's bodily fluids. This can be a gateway for bacteria and viruses to enter your bloodstream. Many STIs can be transmitted this way, even if the person shows no symptoms whatsoever. Let me walk you through the main ones you need to be aware of. Gonorrhea and chlamydia can cause throat infections. These might feel like severe sore throats, but often they're completely asymptomatic. You might not even know you've got it, but you can still pass it on to others. In the UK, these are amongst the most common STIs, with gonorrhea cases actually rising in recent years, particularly amongst older adults who've re-entered the dating scene. Syphilis is another serious condition that can cause an ulcer, called a chancre, in the mouth. Syphilis had nearly been eradicated in Britain decades ago, but it's made quite a comeback. Left untreated, it can cause severe complications years down the line. Then we've got viral infections like herpes and HPV, which are particularly concerning. Herpes can cause painful sores in and around the mouth. Once you've got it, it stays with you for life, though antiviral medications can manage outbreaks. HPV deserves special attention because I've noticed quite a few questions about it in the comments. HPV stands for human papillomavirus, and there are many different strains. Some strains cause genital warts, but others are more sinister. Certain strains of HPV transmitted orally can lead to cancers in the throat, tongue, and tonsil area. This type of cancer has become more common over the past couple of decades, and oral sex is now recognized as a significant risk factor. Now, condoms do reduce HPV transmission, but they don't provide 100% protection because HPV is transmitted through skin-to-skin contact, not just bodily fluids. The virus can be present on skin that isn't covered by a condom. This is why the HPV vaccine is so important. And it's not just for young people. If you're under 45, you might still be eligible for the HPV vaccine on the NHS or privately, even as an older adult. It's worth discussing with your GP. And then there's HIV. The risk with oral sex is lower than with penetrative sex, but it's not zero. The risk increases if there are cuts, bleeding gums, or sores in your mouth. If you've got gum disease, or you've just brushed your teeth vigorously before oral sex, you've got tiny abrasions that can allow the virus to enter your bloodstream. The bottom line is this: if you don't know your partner's STI status with certainty, and by certainty I mean you've both been tested recently, and you're in a mutually monogamous relationship, there's considerable risk. The problem isn't the fluid itself, it's the potential pathogens hiding within it. Now, let me give you some practical information, because I've seen several people asking, what tests should I actually get? Right, here's what you need to know. If you're sexually active with new or multiple partners, you should be getting tested regularly. I recommend every 3 to 6 months. In the UK, you can get tested at your local sexual health clinic, often called GUM clinics, which stands for genitourinary medicine. These services are free and confidential on the NHS. The standard STI screen typically includes tests for HIV, syphilis, gonorrhea, and chlamydia. For oral concerns specifically, make sure they take a throat swab, not just genital samples. Many people don't realize they need to specifically request throat swabs. You can also get home testing kits now, which you order online, do at home, and post back to a lab. Companies like SH24 offer free NHS-approved home testing kits in many areas of England. Or you can go to your regular GP, though there may be a charge if you go privately. Testing typically costs between £50 and £100 if you go private, though as I mentioned, NHS services are free. Results usually come back within a week or two, sometimes faster for certain tests. HIV testing now includes fourth-generation tests that can detect infection as early as 4 weeks after exposure. There's also something called PrEP, pre-exposure prophylaxis, which is a medication that can prevent HIV infection if you're at high risk. It's available on the NHS in England, Scotland, and Wales. For those of you who've been married or in long-term relationships and are now dating again after divorce or bereavement, please don't feel awkward about this. The sexual health landscape has changed quite a bit over the past few decades. STI rates amongst people over 50 have actually doubled in the past 10 years in the UK. You're not alone in navigating this, and there's absolutely no shame in protecting yourself. Finally, there's a much rarer risk I should mention: allergies. It is possible to have an allergic reaction to proteins in seminal plasma. This is called human seminal plasma hypersensitivity. In some people, this can cause local itching, redness, or swelling. In very rare cases, it can trigger a severe systemic reaction like anaphylactic shock. It's not common, but it's real. If you've ever noticed such symptoms, you should speak with a doctor. There are actually treatments available, including desensitization therapy in some cases. Let me summarize this crucial section. From a digestive perspective, it's harmless. Nutritionally, it's irrelevant. But from an infectious disease perspective, it can be quite risky if you're not in a tested monogamous relationship. Since we're talking about bodily fluids, it's only fair to briefly mention vaginal fluid as well, as the safety principles are very similar. Vaginal fluid is also a complex mixture, brilliantly designed by nature to keep the vagina healthy, moist, and protected. Just like with semen, the primary medical risk with oral contact is STI transmission. All the infections we've just discussed, gonorrhea, chlamydia, herpes, HPV, and HIV, can be transmitted through oral sex on women as well. That's why barrier protection, like dental dams, is the most effective method of reducing this risk if you're not in a long-term, mutually monogamous, tested relationship. This naturally leads us to relationships and communication, because this isn't just a medical issue. It's an intimate one. The absolute non-negotiable foundation is open and honest communication. It can feel uncomfortable to discuss sexual health history and STI status, but it's a sign of tremendous maturity and respect. I had a patient once, a gentleman in his 60s, who'd recently started dating after his wife passed away. He came to me in a bit of a panic after being intimate with a new partner because he'd had bleeding gums. I encouraged both of them to get tested together, and both tests came back negative. What happened next was quite remarkable. The shared testing experience actually brought them closer together. They felt safer, more honest, and more connected. That's the deeper truth here. Safety doesn't destroy romance. It strengthens trust. When you and your partner know you're both healthy, intimacy becomes freer and more joyful. Think of it as a team effort. Frame it positively. Your health and mine matter so much to me. Let's get tested together so we can both relax and enjoy ourselves. Love and common sense should go hand in hand. This brings us to barrier methods. Condoms and dental dams are your best mates if you're not in a long-term, tested, monogamous relationship. Using them every single time is the smartest decision you can make. Yes, I know what some of you are thinking. Oral sex with a condom? That rather defeats the purpose, doesn't it? I understand the concern, but flavored condoms do exist for precisely this reason, and when it comes to your health, a bit of latex is a small price to pay for peace of mind. For those asking about dental dams, they're thin latex or polyurethane sheets used as a barrier during oral sex on women. You can buy them at most chemists now, or online. In a pinch, you can even cut open a condom to create a barrier, though proper dental dams work better. And no, cling film is not a suitable substitute, despite what you might have read online. It's not designed for this purpose and can tear easily. Finally, and this is absolutely vital, we need to talk about consent and well-being. Swallowing, or any sexual act for that matter, is a personal choice. It should never be an expectation or something a partner pressures you into. A respectful partner will honor your boundaries without question, full stop. There should be no shame on either side. For some people, it's an act of intimacy they enjoy. For others, it isn't, and that's perfectly fine. True intimacy is built on feeling safe enough to say no. Remember, acceptance creates closeness, whilst judgment creates distance. And for those of you navigating new relationships later in life, please know that your boundaries are just as valid now as they were when you were younger. Don't let anyone make you feel like you're being prudish or old-fashioned for wanting to protect your health. Your well-being matters, regardless of your age. Right, let's bring this all together with the key takeaways from today's discussion. First, from a digestive standpoint, swallowing seminal fluid isn't inherently harmful for healthy people in a tested healthy partnership. Second, the idea that it's a superfood or provides testosterone is complete rubbish. The nutritional content is far too small to have any real impact on your health, and there's no meaningful testosterone present. Third, and this is what I most want you to remember, the primary medical risk is STI transmission. This is the main concern, and it's very real. Whether you're 50, 60, 70 or older, ST is don't discriminate by age. If anything, older adults are at higher risk because they're less likely to use protection and less likely to get tested regularly. And finally, safety and intimacy go hand in hand. The foundation is open communication, regular testing, using barriers when appropriate, and deep respect for each other's well-being and consent. These conversations might feel awkward at first, but they're absolutely essential. I hope this honest, evidence-based explanation has given you the clarity you were looking for and empowered you to make healthy, informed decisions. If you found this video helpful, please do click the like button. It helps other people find this information. And if you'd like more medical insights on topics that aren't always easy to discuss, subscribe to the channel. Now I want to hear from you. What other health questions would you like answered? Drop them in the comments below. Your questions help shape the content we create here. And remember, there's no such thing as a silly question when it comes to your health. Thanks ever so much for watching, and stay well.